Even before the Ebola outbreak, Sierra Leone was one of the most dangerous places in the world for a woman to give birth. The country has one of the highest infant mortality rates and one of the weakest healthcare systems. At one point, there were only 120 doctors to treat a country of 6 million people. Then, Ebola hit. And the meager resources once allocated to sustain basic services were desperately diverted to fight the disease. People wait hours, if not days, for an overburdened fleet of ambulances to transport Ebola patients. If a patient is lucky enough to get to a treatment center, there aren't enough hospital beds for those infected, let alone those with other diseases and conditions. And the bare essentials, like rubber gloves, are running out, forcing some clinics to shut down. The system is buckling under the strain. And the United Nations warns that women are most at risk.
Partly because of their role as healers, partly because of their role as carers in the home, and partly because also they are most involved in household activities. And this puts them at particular risk of getting infected.
And the risks are even greater if a woman is pregnant. In the worst Ebola-affected countries, more women are now dying from complications after choosing to give birth at home.
So where do you send this woman? There are no places to go if you want to deliver. You can choose by going home and delivering at home. That's not safe. You can go to like a community center and maybe do the delivery, but you don't know who was the woman delivered before you come.
No good options for the women of Sierra Leone, once the caretakers of the country, now left behind by a struggling healthcare system.